I'm Sarah Beaver, Communicable Disease and TB Nurse with Surry County Health and Nutrition Center. Today, I would like to speak with you about a very serious bacterial disease called tuberculosis, or TB. TB disease is caused by bacteria. The bacteria usually attack the lungs, but TB bacteria can attack any part of the body, such as the kidney, spine, and brain. A person with TB can die if they do not get treatment. TB germs are put into the air when a person with TB disease of the lungs or throat coughs, sneezes, speaks, or sings. These germs can stay in the air for several hours depending on the environment. Not everyone infected with TB bacteria becomes sick. As a result, two TB-related conditions exist: latent TB infection and TB disease. People with latent TB infection have TB germs in their bodies, but they are not sick because the germs are not active. These people do not have symptoms of TB disease and cannot spread germs to other people. However, they may develop TB disease in the future. They are often prescribed treatment to prevent them from developing TB disease. You do not need to be tested if you have spent time with someone with latent TB infection. People with TB disease are sick from TB germs that are active, meaning they are multiplying and destroying tissue in their body. They usually have symptoms of TB disease. The general symptoms of TB disease include feelings of sickness or weakness, weight loss, fever, and night sweats. The symptoms of TB disease of the lungs also include coughing, chest pain, and the coughing up of blood. Symptoms of TB disease in other parts of the body depend on the area affected. People with TB disease of the lungs or throat are capable of spreading germs to others. People with TB disease are most likely to spread the germs to people they spend time with every day, such as family members or coworkers. You should get tested for TB if you have spent time with a person known or thought to have infectious TB disease, you were born or frequently travel to countries where TB is common, including Mexico, the Philippines, Vietnam, India, China, Haiti, and Guatemala, or other countries where TB is common. You lived or currently live in a large group setting or are employed in a large group setting where TB is more common, such as homeless shelters, prisons, jails, or nursing homes. You are a healthcare worker who cares for patients with TB disease. You are part of a population that is more likely to have latent TB infection or TB disease, including people who do not have access to health care, have low income, or misuse drugs or alcohol. You have a medical condition that weakens the immune system, including HIV infection, substance use, such as injection drug use, specialized treatment for rheumatoid arthritis or Crohn's disease, organ transplants, severe kidney disease, head and neck cancer, diabetes, or medical treatments such as corticosteroids. In addition, children, especially those under 5, have a higher risk of developing TB disease once infected. Therefore, testing for TB infection in children who may have been exposed to a person with TB disease is important. If you are part of one of these high-risk groups, please reach out to your primary care provider or your local health department for more information.